A warm welcome to everybody. I'm Dr. Niharika Gill, working as a consultant rheumatologist at Lilavati Hospital. I have been in this field for more than 30 years. So today we are going to discuss about rheumatoid arthritis. But rheumatoid arthritis is one of the most common inflammatory arthritis which we see in our clinical practice. So what is RA? RA is nothing but a joint pain involving the small joints of the hands, the feet, the legs, and it involves all different types of joints involving even your cervical spine. Because generally what happens, we never expect a young girl presenting with a neck pain. You always think that it is more of a spine surgeon problem. No, it is a rheumatoid arthritis. And somehow there's a very little awareness, though we have been talking on different social platforms, social media, newspaper cuttings and Instagrams, but somehow 80% of the society is unaware of rheumatoid arthritis. So what happens that the treatment is delayed, and the new what we are trying is to make you all aware that this disease is a very, very progressive disease, and if it's not picked up earlier, you may miss the bus, because the disease can lead to extra articular manifestation, that means involving the eyes, the lungs, the kidney, the nerves, and even the brain. And sometimes it makes you so bedridden and you become really, really depressed, because the pain is so much that you're confined to four walls of the house. And the important part of it, that it affects majority of the time 80% the females, and the age group is from the age of 30 to 50 years. It's not just 30 to 50 years only. Sometimes we do see a pediatric age group too, coming at the age of 3 years. And sometimes they're coming at the fag end of their life, that is almost after 70 or 80 years. When they come at the age of 70 to 80 years, you think that it's a degenerative arthritis. No, it's what we call as a late onset rheumatoid arthritis. And mind you, I won't say it's a treatable condition, but I can say that you can prevent the progression if you reach early, and we can start with the treatment. And the treatment is very simple. The first is just first understanding, do you belong to which types of arthritis? If it's in a rheumatoid, you require a good anti-inflammatory drugs and a conventional disease-modifying anti-rheumatic drugs. And with the advancements of knowledge about the different inflammatory pathways of this disease, we have newer drugs which we call as biologicals. And these are the drugs which really make you absolutely a normal person if you have taken the treatment earlier. And it's just not the treatment that we have to give to relieve the pain. You have to think about the other aspect of your life, that is your physical, the mental, the spiritual also part of it, and the finances burden to the patients and the patient's family. So what I can guide you in a way that earlier you come to a rheumatologist, get yourself treated, I think so life will be bliss. And we also teach you to live with what we call as a living with arthritis. The earlier you convince yourself that I am going to fight my arthritis in whatever way, I think so the justice has been done by both the patient and by the doctor. Thank you so much.